Dear friends, greetings. Welcome to Uniforeva Eskool Epilepsy Basics Module 2. Let us start with understanding some terminology of epilepsy. Status epilepticus is a dangerous condition in which epileptic fits follow one another without recovery of consciousness between them. Normally, seizures last for 1 to 2 minutes, but during status epilepticus, seizures last for more than 5 minutes. It's a medical emergency. Refractory epilepsy, also called as drug resistance epilepsy, occurs when a person has failed to become seizure free with adequate use of two different classes of seizure medications, that is anti-epileptic drugs, tried alone or together in optimal dose. In this condition, doctor may advise epilepsy surgery. Let us learn some epilepsy syndrome. Lennox-Gastaut syndrome is gross neuronal damage due to brain injury during birth or mechanical injury resulting into multiple type and multiple number of seizures in children. Benign Rolandic epilepsy. It's a partial epilepsy in age group of 7 to 10 years, predominantly in male during sleep, may involve laryngeal or pharyngeal jerking. Infantile seize spasm, also known as West syndrome, occurs in infant of 1 to 12 months, characterized by spasm of head or neck, trunk, intellectual decline, and specific ECG changes. Febrile convulsions are brief generalized seizures happening in children 6 months to 5 years of age due to high fever, not due to meningitis or encephalitis. Let us know the diagnosis of epilepsy. There are 4 steps of diagnosing epilepsy. One is thorough history taking from patient, from relatives, and from observers. Then physical examinations like especially neurological system, higher psychic functions. Laboratory investigations are also useful like serum electrolytes, serum prolactin, blood sugar, complete blood count, TFT, LFT, and cerebrospinal fluid studies. One of the best way to diagnose epilepsy is imaging like EEG, electroencephalograph, video EEG telemetry, CT scan of brain, MRI, MRS, PET, that is positron emission technology, and SPECT. So for the pathophysiology is concerned, there are 2 neurotransmitters which are involved in epilepsy. GABA, which is inhibitory neurotransmitter which controls neuronal firing. Glutamate is excitatory neurotransmitter which provokes neuronal firing. During epilepsy, it is seen that there is very low activity of inhibitory system, that is GABA, and very high activity of excitatory system, that is glutamate. And this leads to epileptogenesis or abnormal neuronal firing, also called as seizure. Not only that, it is seen that abnormalities in ion channels like sodium channel, potassium channel, and calcium channel may cause prolongation of depolarization state, and that may lead to seizure also. So let us recap. Status epilepticus is a dangerous condition in which epileptic fits follow one another without recovery. Any seizure lasting for more than 5 minutes are called status epilepticus. Refractory epilepsy, that is drug resistant epilepsy, patient not respond to 2 different class of anti-epileptic drugs given alone or in combination. Then we learned Lennox-Gastaut syndrome is a gross neuronal damage due to brain injury leading to multiple type of seizure. Benign Rolandic epilepsy, a partial epilepsy in age group of 7 to 10 years during sleep or involves laryngeal and pharyngeal jerking. Infantile spasm, also known as West syndrome, occurs in infant 1 to 12 month. Spasm of head or trunk may have intellectual decline and specific ECG changes. Febrile convulsions, brief generalized seizures in children 6 months to 5-year-old due to high fever. Then we saw diagnosis, history taking, physical examination, laboratory testing and imaging. Then we saw pathophysiology of epilepsy, and we saw that high activity of excitatory neurotransmitter glutamate and low activity of GABA lead to abnormal neuronal firing, that is epilepsy. Thank you.